Welcome everybody to our May edition of Lunch and Learn. I've got 11:59 by my clock, so I'm going to get us started in just a minute. As folks are joining us, just a reminder, this is run in a webinar format, so everybody on the call will be muted. You will have opportunity to ask questions in the chat feature, and either Deb or myself will answer those questions at the end of the session. Another reminder, this is being recorded currently, so everybody that's attending today will get a copy of the PowerPoint, the permission to contact form, and a link to the Kinship Navigator YouTube channel where this will be posted. It also will reside in the Kinship Navigator online education drop down right on the Kinship Navigator webpage. We are at 12 o'clock, so I'm going to kick us off. Again, welcome to our May Lunch and Learn. Today, we're going to be talking about Kinship Caregivers and Medicare Medicaid. Big thanks to Deborah Merced for joining us from CMS, and also a big thank you to Times Union and Curcarito, our co-sponsor for our Lunch and Learn series. So our Lunch and Learn series, in case this is the first time you're joining us, are 30-minute sessions. They are run on the third Thursday of every month from 12 to 12:30. And the whole idea is to give a brief overview of a subject matter that kinship caregivers, kinship professionals would be interested in. So here we have some snippets from past Lunch and Learns. We've talked through family court, NASW, school administrators, Cornell cooperatives, caregiving respite, child permanency mediation, just to name a couple of them. This month, we're talking about Medicare Medicaid, and next month, we will be joined by Hunger Solutions to talk about kinship care and WIC. I am Rae Glaser. I am the director of the New York State Kinship Navigator program and the chair of the New York State Kin Care Coalition. The New York State Kinship Navigator, if you're not familiar, is information, referral, and education for kinship caregivers. We are the front door for kinship caregivers all across New York State, as well as prospective kinship caregivers and kinship professionals. We provide general information on common kin caregiving issues, as well as referrals to local kinship programs, permanency resources, and other services. We partner with local kinship services, the Department of Social Services, to promote financial and legal security and stability for kinship children in New York. Our helpline is run Monday through Friday, 10 to 4, and our website is right below, www.nysnavigator.org. So just to expound a little bit, information, we have legal fact sheets on our website for different caregiving options for kinship caregivers, financial assistance, school enrollment, accessing official documents, basically any type of facet that a kinship caregiver would need. We have a fact sheet on. They are all cited, which means that they are cited with legal language, but they are all written so that a caregiver or a professional can understand them. We have county resources on our website, so you can click on a county and find kinship resources, legal resources, aging, youth, county resources. And we have our helpline that's Monday through Friday, 10 to 4. We have a Kinship Navigator staffed on our helpline. We also have an online chat feature on our website where you can chat us as well as email. We do our intakes in 37 different languages. We have the ability for interpreting services, so we can service English, Spanish, most common languages. We do provide referral services. We work very closely with the 14 local kinship programs, as well as the 15 permanency resource centers, as well as legal providers and other kinship supports across the state. And we provide educational seminars to local human service agencies, Lunch and Learns, like you are here today. We have an online video archive, so if it's more accessible to a caregiver or professional to see something rather than read it, we have videos on financial one-on-one, how to fill out an application for financial assistance, legal one-on-one, kin gap. All of these seminars are recorded, as I said, as well. And we also provide leadership, co-leadership with the Family Enrichment Network for the statewide Kin Care Coalition to further legislative education on kinship care. So here's a snapshot of our website, www.nysnavigator.org. As you can see in the bottom corner, there's our online chat. We've got right at the top information on our legal fact sheets, online education, how to contact us, a little bit more about the Kinship Navigator, as well as some hot buttons right there on the home page, specifically when it comes to registering for sessions like this, Kin Care Coalition meetings, etc. One of the main components that we've kicked off with Kinship Navigator in the last couple of years is our virtual case management program. So while we service all 62 counties in New York State, we do provide virtual case management in a collection of those counties, currently 21 of them. And what we do for virtual case management is we have a case manager that provides services in anywhere from 6 to 9 counties. They work with Kinship Caregivers one-on-one to assist them with applying for benefits, understanding their legal options, assisting them with tangibles as possible, and whatever types of support Kinship Caregivers need. We are not on site with those caregivers like local case management programs, but we provide those specialized services in specific regions where there's not on-site local kinship programs that are funded by OCFS. You can see a snapshot of the counties that we currently provide services to. If you're interested in those services, you don't have to do anything special. Just give our helpline a call and we will connect you with the virtual case manager that services that county. We also provide services through our permission to contact form. This is a great tool for human service professionals that are working with kinship caregivers or come across caregivers. It's easily downloadable right on our website. You're going to get a copy of it from today's presentation, and our link is right here live. If you are working with a kinship family or prospective kinship family, we ask that you just fill that out with them. On the front page, it explains the Kinship Navigator and our services, and on the back, it provides contact information for the caregiver. If you fax that or email it to us, we are able to reach out to that caregiver. It acts as a release form so that we can connect with them and explain kinship services. You are also more than welcome to give our helpline to any caregiver, but we have found through past evaluation studies that a lot of caregivers are very overwhelmed by everything that's happening in their lives right now. So giving them a phone number to an organization, they may or may not call it, but this permission to contact form takes the onus off of the caregiver so that the navigator is able to reach out directly to them. In the 5 counties that we piloted this back in 2012 when it went live, we found 600% increase in caregivers that we were able to reach through that permission to contact form simply because the caregiver didn't have to make a call. So nothing special you have to do. If you come across with a kinship caregiver, feel free to have them fill that form out, fax it to us, and we will reach out to them directly. So with that, I'm going to turn it over to Deborah Merced to talk a little bit more about Medicare and Medicaid, as a lot of our families find that financial security is one of their main concerns. Helping them access benefits in any way, shape, or form is something that all of the kinship programs I know strive to do. So thank you for joining us today, Deb. Over to you.
Thank you so much and welcome. And today we'll be talking about Medicare and the cost of Medicare. So what is Medicare? Medicare is a health insurance for people 65 and older, and for those individuals under 65 with certain disabilities, especially ALS, also called Lou Gehrig's disease, without a waiting period, and anyone who has at any age with end-stage renal disease. A note, to get Medicare, you must be a U.S. citizen or lawfully present in the U.S. and must reside in the U.S. for 5 continuous years. What agencies are responsible for Medicare? Medicare, who handles enrollment and premiums for Medicare? Social Security enrolls most people in Medicare. Those individuals who retired from the Railroad Retirement Board will enroll their retirees into Medicare. Federal retiree premiums are handled by the Office of Personnel Management, and the Centers of Medicare and Medicaid Services administers the Medicare program in regards to Medicare Advantage, fee-for-service, prescription drug plans. Next slide. Who gets enrolled into Medicare automatically? Are those individuals who are in receipt of Social Security benefits or are receiving their railroad board benefits. Once you turn 65, we will mail you a package 3 months before your 65th birthday, or on the 25th month that you have already received disability benefits. In this package, it will include your Medicare card. Next. No, there you go. Once you get this package, you keep it to accept your Part B. If you decide to refuse your Part B, you will follow the instructions in the Get Ready for Medicare package. Carry your card when you're away from home. Let your doctor, hospital, or other healthcare provider see your card when you need healthcare. If you need a replacement card, you can visit medicare.gov/account, and you can either create an account if you do not have one. And if you do have an account, you're going to log into your secure Medicare account, and it will allow you to print an official copy. You can also call 1-800-Medicare if you do not have a Medicare account, and they will also mail you a new Medicare card. Some people must take action to enroll in Medicare. So if you aren't already automatically enrolled in Part A and B, you will need to enroll with Social Security. You can visit socialsecurity.gov, or you can call them at 1-800-772-1213. And if you happen to be retired from the railroad, you will contact the railroad board at 1-877-772-5772. Always remember, the age for full Social Security retirement benefits is increasing. Medicare eligibility, however, will remain when you turn 65. When can I sign up for Medicare? You can enroll during your initial enrollment period, also known as IEP. You can enroll during a special enrollment period in certain circumstances and during the general open enrollment period. Your initial enrollment period, it's a 7-month window. So it begins 3 months prior to the month you turn 65, the month of your birthday, and 3 months after your birthday. So during my initial enrollment, you can enroll or you can join in Part A, Part B. You can join a Medicare Advantage plan, but you must have Part A and B. You can also join a Part D plan, also known as a prescription drug plan, and you can have either Part A and or Part B. During this time, you can buy a Medigap policy, but you must have Part A or B, but not a Medicare Advantage plan. Your Medigap open enrollment period lasts for 6 months from when you're both 65 and have Part B. If you enroll during your initial enrollment period, you will not have a late enrollment penalty. What is a special enrollment? If you refuse your Part B because you were still working, once you retire, you will have an 8-month period when you can enroll in Part A, Part B, and you will use this special enrollment to enroll in a Medicare Advantage plan. And remember, you have to have Part A and B to join. And for a prescription drug plan or Part D plan, you must have either Part A and or Part B. In addition, you have 6 months from the Part B effective date to buy a Medigap policy. And with this policy, you must also have Part A and B. And during this special enrollment, there are usually no late enrollment penalties. What is a general enrollment period? It's a 3-month period each year during which you can sign up for Part A if you have to buy it. You can enroll in Part B. And this coverage or this enrollment usually begins from the period of January 1st to March 31st of each year. Your coverage will begin July 1st of that year. Note, beginning January of 2023, Medicare coverage will become effective sooner for individuals enrolling in the last 3 months of their initial enrollment period, or if you enroll during the general enrollment period, your coverage for these individuals will be effective the month after their month of enrollment. So if you enroll in let's say, July, your coverage will begin in August. And during the general enrollment period, if you enroll in January, you no longer have to wait till July. Your coverage will become effective in February. Next. What is Part A? Most people don't pay a premium for Part A if you've paid at least 10 years of the FICA taxes. If you paid FICA taxes less than 10 years, you will be responsible for paying a monthly premium to get Part A. If you've met the 10 years, your Part A will be free. You may have a penalty if you don't enroll when you're first eligible for Part A, or if you have to buy it and do not enroll timely. Your monthly premium may go up by 10%, and you will have to pay the higher premium for twice the number of years you could have had Part A, but did not sign up for it. Next. What does Part A cover? This is known as your hospital insurance, and it helps cover medically necessary inpatient care in a hospital, which includes a semi-private room, meals, general nursing, drugs, and other hospital services and supplies as part of your inpatient treatment. It also includes care you can get in acute care hospitals, critical access hospitals, inpatient rehab facilities, long-term care hospitals, psychiatric care, inpatient psychiatric facilities, and inpatient care for qualifying clinical research study. And you can also get inpatient care in a skilled nursing facility after a related 3-day inpatient hospital stay, and if you met all of the criteria. Part A also covers blood for inpatient. It covers hospice care, home health care, and inpatient care in a religious non-medical health care institution. Next. Okay, so this is what you would pay for 2022 if you only had original Medicare. So if you had a hospital inpatient stay, your deductible for each benefit period would be $1,556. If you're in the hospital for 1 to 60 days, you will have no co-insurance for this benefit period. If you're in the hospital for 61 through 90 days, you will have a $389 co-insurance per day for each benefit period. Anything 90 days and above, your co-insurance will be $778 per each lifetime reserve day. After day 90 for each benefit period. And each benefit period is up to 60 days, or your lifetime reserve is up to 60 days over your lifetime. Beyond lifetime reserve days, all costs. Note, you will pay for private duty nursing, television, phone in your room. You pay for a private room unless it's medically necessary. We will also cover mental health inpatient stay, and you will have the same co-pays. Your deductible will also be $1,556. For 1 to 60 day stay, you will have a 0 copay. From 60 to 90 days, you have a $389 coinsurance per day for each benefit period. Next. And of course, from day 1 and beyond is $778 coinsurance per each lifetime reserve day. You will also have a 20% copay or coinsurance of the Medicare approved amount for mental health services you get from doctors and other providers while you're a hospital inpatient. Note, there is no limit to the number of benefit periods you can have when you get mental health care in a general hospital. You can also have multiple benefit periods when you get care in a psychiatric hospital. And always remember, there's a lifetime limit of 190 days. Next. For a skilled nursing facility stay, from your first day to the 20th day, you will have a $0 deductible or copay for each benefit period. From days 21 to 100 days, you'll be responsible for $194.50 coinsurance per day for each benefit period. Anything beyond 101 days, you are responsible for all costs. For home health care, there's a $0 coinsurance or copayment for these services, and you have a 20% coinsurance of the Medicare approved amount for the durable medical equipment you may need. Next, hospice care. There's $0 copays for hospice care. You may need to pay a copayment of no more than $5 for each drug and other similar products for pain relief and symptoms control while you're at home. In the rare case your drug isn't covered by the hospice benefit, your hospice provider should contact your Medicare drug plan to see if the medicine is covered under your Medicare drug coverage Part D. You may need to pay a 5% of the Medicare approved amount for an inpatient respite care. Medicare does not cover room and board when you get hospice care in your home or another facility where you live, like a nursing home. For blood, if the hospital gets it from the blood bank at no charge, you will have no charge. If the hospital has to buy blood for you, you must either pay the hospital costs for the first 3 units of blood you get in a calendar year, or have the blood donated by you or someone else. Decision, do I need to sign up for Part A? You should consider if you've met the 10-year requirement, it's free for most people, and you should enroll. You can pay for it if your work history isn't sufficient. So if you did not pay the taxes that's equivalent to the 10 years, you can buy Part A. Remember, there may be a penalty if you delay enrolling in Part A. Always talk to your benefits administrator if you or your spouse are actively working and are covered by an employer plan. A special note, to avoid internal revenue IRS tax penalties, you should stop contributions to your health savings account before your Medicare starts. What is Part B? Part B is your medical insurance, and it covers medically necessary doctor services, outpatient medical and surgical services and supplies, clinical lab tests, your durable medical equipment like walkers and wheelchairs. It covers your diabetic testing equipment supplies. It covers your preventive services like flu shots and yearly wellness visits, your home health care, medically necessary outpatient physical and occupational therapy and speech language pathology services, and of course, your outpatient mental health care services. Next. Your monthly premium for Part B, the standard premium for 2022 is $170.10. You may have to pay a higher amount depending on your income. Some people who get Social Security benefits pay less than this amount due to the statutory hold harmless provision. And that basically says that if you are paying your Part B through your Social Security benefits, they cannot take out more than the COLA increase every year. So your premium may be higher if you didn't choose Part B when you first became eligible. Your premium may go up 10% for each 12-month period that you could have had Part B but didn't take it. Next. So what do I pay for Part B in original Medicare? My yearly deductible is $233. Your coinsurance for Part B services will be 20% coinsurance for most covered services, like doctor services and some preventive services if the provider accepts assignment. 0 for most preventive services, and 20% coinsurance for outpatient mental health services and co-payments for hospital outpatient services. Next. So when should you have Part A and Part B? If you want to buy a Medicare supplement Medigap policy, if you want to join a Medicare Advantage plan, if you're eligible for TRICARE for Life, Civilian Health and Medical Program, or the Department of Veterans Affairs, if your employer coverage requires you to have it, less than 20 employees. Make sure you talk to your employer or union benefits administrator before you decide to refuse Part A and B. Next. IRMA. This is called the Medicare Income Related Monthly Adjustment Amount, is an amount you may pay in addition to your Part A or Part D premium if your income is above a certain level. Social Security Administration sets 4 income brackets that determine your or you and your spouse's IRMA. SSA determines if you owe an IRMA based on the income you reported on your IRS tax return 2 years prior, meaning 2 years before the year that you start paying IRMA. If you are expected to pay IRMA, SSA will notify you in writing that you have a higher Part A and or Part D premium. Next. So for Part B, these are the income brackets. So for this year, Social Security will be looking at your tax returns from 2020. In any of these brackets, you look and see if you're between 91 and under, you'll pay $170.10 a month. If you're above the brackets, they keep going up and you will pay that additional IRMA. Each year, it may go up, it may go down. Next. Also, there's what we call a Part D or prescription drug plan. IRMA, also same concept. It's based on your yearly income for 2020 is what you're going to pay for 2022. So if you are 91,000 and less, you have a 0 Part D IRMA, but you will pay the monthly or yearly plan premium. If you fall into the bracket, let's say of 114 to 142, you will pay a Part D IRMA of $32.40 in addition to your yearly plan premium. And I think that's the end of the presentation. Next. Yep.
Absolutely. Thank you so much, Deb. This is really helpful. Just a reminder for everybody on the call, we will be sending that PowerPoint out. So there are a lot of figures in there, a lot of links. So if you have any questions, we've got Deb's email address right here for you. If anybody has any questions for the chat, we do have a couple of minutes. Feel free to drop them in there. But again, if you think of something afterward, feel free to email Deb, feel free to email myself. We'll make sure that we get that covered. So with that being said, thank you very much for joining us today. We're going to end right on time. We have absolute perfection for time. And The next Lunch and Learn will be on June 16th at noon, and we will be discussing kinship caregivers and WIC. So the registration should go live for that tomorrow. Feel free to register for the next session. And again, thank you so much for joining us today, Deb. We really appreciate it. And thank you all on the call for joining us during the lunch today. Have a great day.
You too, enjoy.
Thank you.